Hi there, I'm Susan Conn. I am the nurse practitioner for University Park Family Medicine, and Facebook has asked some questions that I'm happy to answer for you. So the first question is, what do diabetes and obesity play in heart health? So if you have diabetes and obesity, you're at much greater risk to develop heart disease. So being overweight can affect our ability to manage our blood sugars. So when we have out of control blood sugars, that damages blood vessels over time, which can cause heart disease. So managing your blood sugars when you're diabetic and managing your weight is of the utmost importance. You want to make sure that your blood sugar is always in control and that your weight, you can drop it if is preferred. So diet and exercise are huge to prevent heart disease. Okay, now I'm going to ask the next question. Is it cold or is it allergies? How can I tell the difference? So we've all had a cold. It's miserable. You have a cough and sneezing, nasal congestion, runny throat, or runny nose, sore throat. The duration, 7 to 10 days. You can take over-the-counter symptomatic relief medications for it. So allergies are just a little bit different. They have some of the same symptoms with it, but you can end up with like a scratchy throat, watery eyes, itchy, sneezing, and the duration is really dependent on what you're allergic to. So if you're allergic to a dog, you may have those symptoms while you're around that particular animal, and when you leave, they go away. With seasonal allergies, however, it can last for months. We have patients who start taking medication in April and don't stop taking it until the first hard freeze, simply because of allergen control. The third question, I'm trying to lose weight. What guidelines should I follow before taking on diet and exercise? So there are several things we'd like you to do as providers before you decide to try and lose some weight. First, consider your fitness goals. What do you want to accomplish by losing weight and changing your diet? So how much weight do you want to lose? How much do you need to lose? How much time do you have to exercise? Second, start slow and build yourself up. You don't want to make huge changes and then just get sick of it because you're not meeting your goals. So short-term goals. So starting slow, trying to build in more exercise slowly. Park further away in the parking lot, take the stairs, then maybe consider joining a gym and start working your way up very slowly. Trying to change your diet immediately is going to set you up for failure. So we ask that you start taking some slow steps. Decrease your carbohydrates, maybe add a little bit more leaner proteins such as chicken and turkey, and try and get some more like lean meats, carbohydrates. Choose the wheat version so that way your body digests them a little bit more slowly, and just start less fats. And then monitor your progress. How do you feel before you exercise, during exercise, and after? Is it harder for you to catch your breath while you're exercising, or after you're exercising, you're having a really hard time catching your breath? If you are, that's the time to kind of slow down, take a step back, readjust what you're doing, and see if you can. Now, you should not be able to catch your breath during exercise. You should be able to talk, but not a lot. That is the key. We want those heart rate up. We want that your blood pumping, your body pumping that blood so you can get that circulation going, getting that metabolism increased. But if you're having a hard time catching your breath after you're finished, 10 minutes, and you're still breathing hard, you need to come see us so we can further evaluate that. Don't weigh yourself daily either. That's kind of a big mistake people make. So you can do 1 to 3 pound weight loss in a day. So weight should be taken once a week, if that, if you really need a number. I like to go by the feel of your clothes. Are they fitting better? Are they looser? How do you feel overall? Is your health better? Is your energy level increased? And the best way, of course, to lose weight is to do both combination of diet and exercise. And then the fourth question is, what's the difference between a food allergy and a food intolerance? So this is kind of a big deal. Food allergies are very, very dangerous, such as peanuts is the biggest one. So our immune system responds as if the food is very harmful to us, and it gives us quite the reaction. So we can have minor reactions such as hives, red skin, maybe some coughing, but then we can have some serious reactions such as anaphylaxis. So you can have your throat closing, you can have wheezing. So we want to make sure that if you ever have that you be seen immediately. And then the food intolerance is more of a difficulty with digestion. So lactose, for instance. So if you eat a little bit of lactose, you may not have a same response as if you eat a lot of lactose. So if I am lactose intolerant and I eat a huge amount of ice cream, I can expect to have some abdominal pain, some bloating, some excessive gas, and a lot of diarrhea. So the difference between the two is pretty extreme. So you have more abdominal symptoms, whereas the food allergy, you actually have some systemic symptoms such as the red skin and the wheezing. All right, so those were the questions Facebook sent me. It was great to answer them. If you have any more health questions or concerns, I would love to meet you. I'm at University Park Family Medicine, and I can't wait to see you.